Hello, good evening, and welcome to the Majority Caucus. My name is James Agyenim Boateng. It's a pleasure to have you. This evening I have with me as my guest, Deputy Minister for Communications, Honorable Felix Kwakye Ofosu. Same time last week we were here and we took a good look at President Mahama's Book of Achievement, Accounting to the People. We did look at Pillar 1, which is on the theme putting people first. That is one of 4 pillars on which President John Dramani Mahama campaigned and built his manifesto for the last election. So we've been looking at the deliverables and how far he's come. Last week we dealt with the sector education. This evening we are going to look at the health sector. Felix, good evening and welcome.
Good evening, James.
And good evening, viewers. So, it's our pleasure to have you with us this evening. Now, just by way of a quick recap, what were some of the highlights with respect to the area of education and President Mahama's achievements? What are some of the key things that President Mahama has recorded?
Yeah, last week we spoke about the continuous elimination of school sanitaries. 1,614 out of 2,578 started. We also spoke about the community day senior high schools, 123 of them at various stages of completion. Some of them actually completed, others almost completed, some too nearing completion. We spoke about interventions like the distribution of teaching aids, 100 million exercise books, 2 million uniforms, 12.5 million textbooks, enhancement and expansion of school feeding program from 400,000 pupils to 1.7 million pupils. We spoke about the establishment of 2 universities. We spoke about the support for technical and vocational education. And perhaps it escaped us, the conversion of polytechnics to technical universities. And in a nutshell, we demonstrated that there's real measurable progress in the area of education. We also demonstrated through the percentage scores in the West African Senior Secondary School Examination that indeed progress has been made and that the very best performance witnessed between 2001 and 2008 pales into insignificance when you juxtapose it against perhaps even the worst performance since 2009. And it shows real measurable progress. We also finally stated that we do know that there's more room for improvement and more will be done going forward to ensure that we have an even more robust education system which is suited to our needs.
Great. Now let's focus on what we are looking at today, which is the area of health. If somebody asked you what interventions are being rolled out in the area of health, just say if you were to sum it up in a minute, what is it that you would tell the person?
Before I come to that, when we were putting together the book, Accounting to the People, we were faced with a certain dilemma. Just when you were impressed with achievements struck in one sector, you were then confronted immediately with glaring evidence of even more superior achievements in another sector, which left you completely dumbfounded. Now, if you go to the area of health, it is one of the areas where President Mahama has devoted considerable attention. And without sounding hyperbolic, I can state without fear of contradiction that the government of the NDC, which is led by President John Dramani Mahama, has perhaps done far more in the area of health than any other government that preceded it. And I will give you specific examples. In total, over $2 billion has been invested in the area of health. You see, when you speak about health, there are 3 issues that you look at. You look at access, then you look at quality, and then you look at affordability, and then the outcomes. Regarding access, you look at how do people access healthcare. For instance, if you fell sick today, is there a decent place where you can go and seek healthcare? With quality, you look at the kind of healthcare that is being delivered, whether or not we have the right kind of equipment and other necessities to be able to do it, personnel. And then you look at the access in terms of funding, and then the outcomes. What have we achieved as a country because of all these investments? And we will address that in the time that is available to us. Now, let me put this in perspective. Up until 2014, the total number of hospital beds in public and quasi-public health institutions amounted to just about 11,600. The rest nationwide. The rest was taken care of by private hospitals. Now, in the last 4 to 5 years, under President Mahama's supervision, government has pumped in resources to establish hospitals of various sizes. That would ensure that by 2018, when the program is completed, another 6,000 hospital beds are made available to the people of this country. Now, this is significant. If for all of the years preceding 2014, all governments put together delivered 11,600 hospital beds, and President Mahama and his government worked to add 6,000 additional hospital beds, which is more than half of what we inherited. It is the most significant achievement. Now, how significant is that? The WHO and other agencies concerned with health have a benchmark. They say that for very effective healthcare, every country must have a hospital bed to population ratio of 30 beds to 1,000 people. As of 2014, Ghana's ratio was 0.9 beds to 1,000 people. 0.9 beds. It was less than 1 bed to 1,000 people. After these investments, we will take our ratio to about 1.2 beds per 1,000 people.
Where does that put us on the African score?
In Africa, the leading country is South Africa, followed by Egypt. Then there is Morocco. We are currently joint third with Morocco, if you take into consideration the investment that have been made. So we have moved from way down the ladder to joint third with Morocco after South Africa and Egypt.
So that puts us in the first
three. First three, above countries like Nigeria, Tunisia, Algeria, Cote d'Ivoire, and the like. So it is a very significant achievement. Now, how have we arrived at this stage? President Mahama is currently undertaking 2 teaching hospitals. There's the University of Ghana Teaching Hospital, which is located a few meters away from the Noguchi Memorial Institute at Korle Bu. And let me clarify, there are those who go around saying that it's a project that belongs to the University of Ghana. It is not true. The money for it...
You mean located at the University of Ghana?
At the University of Ghana, and a picture of it is currently displayed on the screen. It costs $217 million. It is a quaternary hospital. What that means is that it is not a tertiary hospital, it's a quaternary. It's higher than the sort of medical care that is being given at Korle Bu. So it will become the most modern and most sophisticated hospital that we have in the country.
But I've heard people who say that it is not, it's not a government project, it's not funded by the government and all of those things, and that, government is not coming clean with respect.
Well, nothing could be further from the truth. Indeed, the loan was acquired by the Ministry of Health through the Ministry of Finance for $217 million from a bank known as Hapoalim Bank of Tel Aviv in Israel. And that is what is being used to finance it. So let us put it beyond doubt.
How many beds is that?
617.
I'm told that there's going to be more like something that looks like a 5-star hotel as
Absolutely.
well.
That is for the second phase. It will be extended to 1,000 beds, and then they will add some facilities like a 5-star hotel, because they want to promote what they call health tourism. So that instead of going to India or Europe or the United States or anywhere in North America for healthcare, people can come to Ghana, and significant resources can be generated from that sort of activity. So that is the first teaching hospital President Mahama is undertaking. Then there's the second phase of the Tamale Teaching Hospital. You know that in 2014, President Mahama commissioned the first phase of the Tamale Teaching Hospital, which has been transformed into a modern hospital. The second phase will make it a 900-bed teaching hospital and will take care of the needs of the people in the northern sector of our country, and even make it possible for people from our neighbors, Burkina Faso, Mali, and what have you, to also come and seek healthcare, and that has added advantages.
Even in its present form, I'm also informed that it's, the Tamale Teaching Hospital, for example, is able to carry out some more sophisticated surgeries that perhaps we are unable to do.
Absolutely, and indeed, the story is told of a very, very, very big man in Ghana, whose name I'm unable to mention because of good reasons, who opted for the Tamale Teaching Hospital ahead of the Korle Bu Teaching Hospital. Not that the Korle Bu Teaching Hospital didn't have that kind of service, but he thought that the Tamale Teaching Hospital had a better facility and had better experts to take care of it. So it tells you about the diversification and decentralization that is taking place. It is very good for our healthcare system.
Again, what does that mean for people in, say, the northernmost part of the country who otherwise would have had to come to, say, Konfanochi or Korle Bu
or 37? That simply means that, first of all, you save transportation and the risk you take traveling that long, and all the hassle and trouble you go through to come and seek healthcare over such a long distance. So it is very, very important, and the people of the northern belt of our country really appreciate this investment. The next project I need to mention is the Kumasi Teaching Hospital. Well, they insist on calling it the 37 Military Hospital Kumasi, which is currently ongoing, and it is a 500-bed hospital. It will also have a 154-unit housing project for members of staff, and this will add on to the services that are being currently rendered at the Kwakye Teaching Hospital, and also make it possible for people in the middle to northern belt of our country to seek healthcare, and it will significantly boost healthcare in that part of our country. Then there is the Ridge Hospital project. The first phase of it is currently ongoing. It's a 420-bed brand new hospital. People say that it's an expansion. It is not an expansion. The old Ridge Hospital was a 200-bed facility. Now, it is not being refurbished. Refurbishment means that the old structures will be expanded and modernized. No, they have built a 420-bed, an all-new hospital, and videos of it are currently rolling. An all-new hospital from scratch, 420 beds. And I'm told by the officials at the Ministry of Health that they would actually demolish the existing structures to pave way for a car park and convert other buildings for other purposes.
That's coming with personal accommodation.
It's coming with personal accommodation, 42-unit personal accommodation, and it has the capacity to render cutting-edge medical services to people in the Greater Accra. It is actually the Greater Accra Regional Hospital, and the official name is the Greater Accra Regional Hospital at Ridge. But of course, that's a mouthful, so Ridge Hospital will pass. But it's a major investment, $250 million. Again, there has been some attempt to create the impression that it is inflated, but it is not. Any suggestion otherwise is completely false. It is baseless and should be dismissed, because proper due diligence has been done, proper scrutiny has been done, and it passes the test for value for money.
Maybe we can give viewers just a sneak preview of what the Ridge Hospital project is about.
The Ridge Hospital project involves the construction of a 620-bed facility. Apart from provision of logistics and equipment, the staff will also be trained on how to handle the equipment that will be installed. The entire project is being financed in 2 phases, with 2 loans, with the first phase estimated at $250 million. The NPP flag bearer Nana Akufo-Addo, in his True State of the Nation address, suggested that the cost has been inflated by $142 million. But this, the Deputy Minister says, is unfounded.
There's been some talk about the fund, the hospital being built at a cost overrun of, I think, $142 million. It's unfortunate because that's just talking about one aspect of this project. As you know, it went through cabinet, it went through parliament, and when it got back to the Ministry of Finance, a value for money audit had to be carried out, and that was done by Crown agents. And in their initial report, they had suggested that perhaps some savings could be made, but that's what happens. That's part of the process. The process is that the report comes out, the clients and the contractors are called, they have a frank discussion so that the contractors can explain why some of the funds are the way they are. If probably the project manager could have told you that this building is being built to a certain specification called the Leadership in Energy and Environmental Design, which means that it's at a much higher standard than other buildings. So at the end of the day, when the discussions were held, it was felt that that $142 million perceived savings could not be obtained. So there were back and forth negotiations, which led to some agreement that savings of $27 million could be made. And that has been plowed back into the project. So if you realize, the initial design had 42 housing units. There are going to be another 42, so there will be 84 in total. And you saw that.
Phase 1 of the Ridge project is 65% complete. When it is fully operational at the end of this year, it will have 420 beds, delivery suites, maternity wards, intensive care units, and other modern facilities.
So that's so much on the Ridge Hospital project. I'm sure that gave you some more insight into what's is currently happening. Now, Felix, again, here in Accra, for people who go through, say, the cantonment area to Dankwa roundabout, they also, I believe, are seeing the police hospital project. Tell us a bit about that.
Yes, that's the police hospital project, which is just around the Dankwa sector. But perhaps we should even speak about other regional hospitals.
I'm going to go there.
Yeah, but the police hospital project is an expansion of the old police hospital, and their services have been in high demand by members of the public. And it's one of the ways that government seeks to decentralize healthcare and take the pressure off existing facilities. When it is completed, it will be a very modern. In fact, they envisage it to become a 600-bed hospital eventually when the full project is completed. But the first phase of it will deliver 120 beds and significantly augment what is in existence.
Now tell us about what is happening also with respect to hospitals at the regional level.
Yes, it is not only the Ridge Hospital which is being worked on by government. There's also the Bogatanga Regional Hospital, which is an existing regional hospital, but it is quite small. It is being expanded into a 386-bed hospital, and they are almost done with the project. The contractors indicate that by the end of this year, they should hand it over to the Ministry of Health. There's also the Upper West Regional Hospital, which is a 160-bed regional hospital, which is being built from scratch, which is also in progress. Then there's the Ashanti Regional Hospital, a 250-bed hospital project, which is being undertaken at Sewia in the Bosontwe district of the region. So that is it for regional hospitals. Then it is instructive to know that in the 8 years preceding the administration of the NDC, that is between 2001 and 2008, no single regional hospital was built in this country. So it is very, very instructive. That puts into perspective the amount of work that has gone into building regional hospitals alone.
So your point, simply put, is that the MPP, for example, has no track record.
Absolutely, they have no track record at all. They have no track record.
Same way they don't have a track record when it comes to, for example, polytechnic education.
Well, they have no track record in many, many, many things. They are the only party in the history of the Fourth Republic that did not establish a regional hospital. President Wallace established 3.
But just by way, I mean, by way of not wanting to digress, it's not too long ago when we heard the former president say that he built a whole polytechnic, which was actually the envy of, say, the University of Ghana.
Well, a search party has been commissioned to look for that polytechnic in question. But as the Americans would say, he probably misspoke. Perhaps he meant something else. We are aware that he did some expansion at the whole polytechnic, but any claim that he built...
He said established.
Any claim that he established the whole polytechnic is clearly exaggerated and not accurate. The whole polytechnic was established by President Rawlings in 1986, and the records are there. So there's no point haggling over that matter.
All right. Now, tell us about district hospitals. What is happening with
before I go there, let me tell you about the Maritime Hospital.
Okay.
It is based in Community 3, Tema, and there's a 130-bed modern hospital, which will significantly boost healthcare delivery in the Tema enclave. You know the Tema General Hospital has come under pressure lately, and this hospital will relieve it of that pressure. There are also plans in the near future to expand and upgrade the Tema General Hospital. So that is that. Then there's the...
I think they intend calling it, is it Tema Maritime International Hospital, or something like that?
Yeah, it is still under consideration. But the most important thing is that it is delivering, it will deliver health services to people there. Now, district hospitals, they are currently, well, that is a maritime hospital on the screens, so viewers can relate to it. They are almost there. They expect to open it by June this year. Now, with regards to district hospitals, only 2 weeks ago, President Mama opened the Dodowa, or the Shai Osudoku District Hospital at Dodowa, which is part of 6 district hospitals being undertaken by the Ministry of Health at a cost of $175 million. The organization putting it up is called NMS Infrastructure. Now, all 7 hospitals are designed the same way, save for minor adjustments to suit the landscape. So if you go to places like Fomena, Kumewu, my own father's hometown, Abetifi, Salaga, Garu Timpani, you find that these projects are ongoing. The Salaga, the one at Garu Timpani, the site has been cleared and work is ongoing. The one at Secondary will start soon. But Fomena, Kumewu, and Abetifi are coming up very, very fast. Dodowa has been completed. It's a modern, beautiful hospital. Indeed, I was at the commissioning and I had the opportunity to be taken around. Then you'll be amazed at the level of sophistication of the hospital.
Tell us what you saw.
I saw a modern 120-bed hospital. But the way they designed it, it is scalable. You can take it to 200 beds easily. All you need to do is to just get the beds and install them. You don't need to
residential facilities for
They have residential facilities for 22 members of staff. They have an oxygen plant which is going to produce oxygen far in excess of the needs of the hospital. So they are even in a position to sell some to other adjoining hospitals, both public and private. They also have, they run on solar energy as an alternative to conventional electricity. They have a modern mortuary. They even have a mother's hostel. They have children's playgrounds and many, many other amazing facilities which would boost the healthcare delivery services within the Shai-Osu Doku district and surrounding areas like Adenta and other places. You see that there's actually a cluster of hospitals in that northeastern part of Accra and getting into rural Accra, and that is for a purpose. The population of that area continues to grow. So all of these people wouldn't need to travel to Accra to Korle Bu. And so there's a benefit for Korle Bu as well in terms of the pressure that is exerted on them. There's also another batch of district hospitals known as the UAJET 6 district hospitals, where 60-bed district hospitals are being constructed at Tepa, in Soko, Konongo, Salaga, Chifopraso. And then if you go to Atomic, a 100-bed municipal hospital is being built. There's also a 120-bed district hospital at Bekwai, which is about 70% complete and should be completed in due course. So these are some of the major hospitals being built. There are also polyclinics.
So what's the impact of these constructions, for example, on employment for artisans, masons, building technicians, and all of those things? I mean, how is this creating jobs for people in that industry?
Well, when the president opened the Dodowa, the Shai-Osu Doku district hospital at Dodowa, he disclosed that the 7 district hospitals that are being ready, mind you, the 7th one is at the Takrady European Hospital, where the hospital is going to be refurbished. But the first phase of that project involves the construction of housing units for staff, and that is also ongoing.
It's nearing completion.
The president said that that project alone has made it possible for 2,000 such artisans to be engaged.
Direct jobs.
That means that $175 million, apart from the materials that will be procured, would also go into the pockets of those working on this, because the masons, the carpenters, the welders, the steel benders, even the suppliers of materials, roofing sheets, cement, iron rods, and what have, even the laborers, those who are not skilled but only offer labor, get money at the end of the day and they put it in their pockets. So when you speak about putting money in people's pockets, it has many interpretations. It's not only white-collar jobs that offer that. In fact, some would argue that some of these jobs pay even better than white-collar jobs. So there's a real benefit in terms of economic well-being that arises out of the execution of these health projects, apart from the obvious health benefits for our people.
All right, now let's come to polyclinics.
Well, as far as polyclinics go, there was a project which was implemented in 3 phases to build 5 polyclinics in the northern, upper east, upper west, and the Bunafo regions. Between 2009 and 2012, the hospitals, the polyclinics in question were completed in the northern, upper east, and upper west regions. Sometime last year, President Mama commissioned 5 in the Bunafo region at places like Wamfie, Nkrankwanta, Kwatere, Techimentia, and Boma, and those have been completed and are currently operational. Now, about a month ago, Parliament also approved 23 million euros for the construction of 10 polyclinics at Besiase, Gomoa, de Rampon, and that is a Wamfie polyclinic on the screen. Briwa, Echisunkwa, Esekuma, Jamra, Aguna Duakwa, Bempong, Akumfide, Ekumfina Akwa, Chifo, Etimokwa, and Gomoa Potin, all in the central region. And all these polyclinics are part of those that will be constructed with the 23 million euros that was passed recently by Parliament. There are also 5 30-bed polyclinics to be sited at Adenta, Ashaman, Botiano, Uduman, and Sege, all in the Greater Accra region. Wow,
impressive. Now, let me quickly just inform our viewers that they can join us on this Majority Caucus via our social media platforms, Facebook/Joy News on TV, Facebook.com/Joy News on TV. And for those who want to send us messages on WhatsApp, 056 0800 000 is the line for which you have to send your messages. The WhatsApp line is 056 0800 000. And you can also send us messages on facebook.com/joynews on TV. Now, how about health centers? It's not just the big issues in health that are also being addressed, but I'm also aware that government is putting in place health centers in order to further decentralize healthcare delivery. What can you tell us about that?
Yes, health centers are essentially aimed at bringing healthcare to the doorstep of the people. It is only a grade higher than CHIPS compound, which I'm sure we'll come to. Currently, about 40 of them have either been completed or are nearing completion in various places across the country. In 2013 alone, about 18 of them were completed at places like Amasaman, Dofo, Poku Krom, New JJT, Pakro, Buipe, Manson, Kwanta, Ebuakwa, Masisosokwe, Keji, Adamso, Kajuro, Timonde, Bonsun, Kwanta, and Dadieso. So these are projects that have been extremely beneficial to the people of this country. And there are many more that are currently under construction. All put together, we are talking about 40 of them. And you see, to put that in perspective again, you know, when Dr. Baumia and the NPP are questioned about their record in health, they also try to show some things. When he held a press conference and published what he claimed to be the achievements of the NPP, guess how many health centers he was able to show? 8. In 8 years, compare that to 40.
That means on the average one a year.
So we have done 5 times. 5 times, well, 1 a year. I like that breakdown. It puts it in even more better perspective. But to put it in perspective, it shows you the sheer amount of work that has gone on in the health sector under the leadership of President Mahama. So they've proven very beneficial for the generality of our people.
Now, health, CHIPS compounds?
Yeah, CHIPS compounds are
which is the first point of call.
Exactly, absolutely. Now, these are designed to attend to basic health needs for the people so that they don't have to travel to large hospitals. In the past, because of the absence of these things, people have to trek long distances, sometimes 20, 30, 40, 50 kilometers to the nearest health center or polyclinic to access healthcare. Government took a decision to bring that to the doorstep of the people. Now, between 2009 and 2012, 1,260 CHIPS compounds were constructed across this country. Currently ongoing is another batch of 1,600, which are being constructed at various places. Indeed, if you check the second part of the Green Book, where we show district-level achievement, you see many of them boldly displayed there. And this is one way in which government is addressing the health needs of our people in very remote places. And it has proven largely successful. What has happened is that because of that, we are getting a handle on maternal mortality. And when we have time to discuss the impact of these projects, we will show that presently.
How about those who are watching and will say that, I mean, so far, listening to you or watching you, it appears that you're focusing a lot on brick and mortar issues. I mean, it's beautiful. It's okay to build these hospitals, but what is being done with respect to equipping them? Because you would be the first to admit that it just doesn't take hospital structures, just brick and mortar, to have a functioning or efficient healthcare delivery. What is being done with respect to equipment?
But that's a very valid concern. Indeed, some have even claimed that we should not build new hospitals, we should simply equip existing hospitals. But the argument are made about the World Bank benchmark on hospital bed to population ratio completely belie that particular claim. So let's just put that behind us. Now, it is not true that we are not equipping hospitals. In fact, in the last 4 years, under a program called the National Medical Equipment Replacement Program, $264 million has been spent equipping 150 hospitals across the country. Let me put that in perspective for you again. If you go to the pediatric units of the Kolebu Teaching Hospital and other surgical units, about 12 operating theaters had been closed for about 8 years before the coming into office of the Mills administration and the Mahama administration. Now, because of the medical equipment replacement program, we have been able to open these pediatric surgical units. If you go to the pediatric unit of the Kolebu Teaching Hospital, you'll find an amazing transformation. And the pediatric unit is where children, the health needs of children, babies, infants who are born with complications are taken care of. And it is a fantastic place that anybody at all can visit. We have pictures of it, which I'm sure we will present.
I'm afraid we have to hold in now. We'll come back and talk a lot more about the National Medical Equipment Replacement Program. We're taking a quick break here on the Majority Caucus. We'll be right back. 。 Welcome back. This is the Majority Caucus here on Multi TV. My name is James Agyenim, and my guest is Honorable Felix Kwakye Ofosu, who is Deputy Minister for Communications. We've been looking at the investment made in the area of health and healthcare under the Mahama-led administration. We've been talking so far about the teaching hospitals as well as the regional hospitals and polyclinics, district hospitals and other such investments and hospital constructions that are coming up. Before we went for that break, I was asking Felix with respect to the investment that is being made as far as equipment or equipping these health institutions are concerned, and he was telling us about $264 million initiative aimed at equipping these hospitals. So, what are these health institutions getting, Felix?
Sure, depending on the size and capacity of the hospitals, you either got an MRI, magnetic resonance imaging machine, you got a CT scan, what they call computerized tomography scan, you got a fluoroscopy machine, X-ray machine, digital mammography machine, oxygen plants, ambulances, and what have you. So, for instance, if you go to our teaching hospitals, they now have MRI machines. And mind you, only a few years ago, people had to travel to Nigeria and other places before they could have their brain scanned or head scanned in MRI. But today it is available. You go to other hospitals, you have CT scans, fluoroscopy machines, you have X-ray machines, digital mammography machines, which is very important for our lady folk because that is what you use to examine the mammary glands or the breast to detect the existence of any lumps which may lead to cancer and other such serious complications. And this is widespread in about 150 hospitals across the country, sometimes in very remote hospitals, district hospitals, and other places where you would ordinarily not have seen this in the past. You have these equipment. Korle Bu alone, and I emphasize Korle Bu because of some of the narratives that have emerged in the wake of some refurbishment that has gone on. Out of the 264 million, Korle Bu alone received about $63 million. I implore you to go to the Accident and Emergency Center today and see the sort of refurbishment that has been carried out. The ICU units, there has been some controversy. It is just the case that they finished refurbishing the place, and the staff there have actually requested that they are trained or retrained on the use of the new equipment so that they will be more effective in delivery. So in a matter of a few weeks, it will be opened to render services to the people. There's a new eye clinic, which through the support of an NGO and a Rotary Club has been put up, which is significantly improving on the services that are being delivered there. So it must be placed on record that just as government has focused on expanding access by establishing modern large hospitals, a lot of resources and effort have also gone into providing cutting-edge equipment to facilitate healthcare delivery.
How about those who are watching you right now and asking themselves, I mean, yes, you've spoken beautifully about the investment you're making, the brick and mortar, the equipment, the retooling, personnel, and all of that. But what really is the point? How is this impacting? Any impact?
Sure.
From these investments?
Sure. It may interest viewers to note that currently, in the whole of West Africa, Ghana has the highest human development indicators. Issues like maternal mortality, child mortality, infant mortality, under 5 mortality, malnutrition, life expectancy, all of those things are inching up or are improving. And we are ahead of our entire West African neighbors. Let me give you specifics. If you go to an indicator like life expectancy, that simply measures the average length or lifespan of the Ghanaian. Before 2009, it was around 56. In other words, averagely, Ghanaians die at 56 years. Currently, it stands at 64, which is an improvement of 8 years. And it can only be a reflection of the health-seeking behavior and health, system that we have in place to ensure that our people live much longer. Of course, we expect that it will go much higher than that, but this shows clear and visible improvement. If you come to an area like infant mortality, that is the number of children who die after they've been born per year. In 2008, analysis showed that out of every 1,000 children who are born, 50 of them die. Currently, it stands at 41, which is a significant reduction. That is 41 out of 1,000 die. In 2008, it was 50. If you go to child mortality, that is children who live up to about 3 years or so who die out of 1,000. In 2008, 31 of such children died. That is out of every 1,000 live births. As we speak, it has dropped from 31 to 19. 19 out of every 1,000 live births. If you go to under 5 mortality, that is children who die before they reach 5. In 2008, 80 children out of 1,000 who are born every year died. Every 1,000 who are born out of each year died. Currently, it has dropped to 60. Of course, we are not satisfied with this. We want to achieve 0 infant under 5 or child mortality, and we are inching closer to it through the investments that we are making. If you come to maternal health care, now in 2008, antenatal care, which was provided by skilled service providers, when a survey was conducted, it was found that in 2008, 95% of mothers received antenatal care from skilled providers. Currently, 97% of mothers do. Again, births that are occurring in a health facility. Of course, as you expand health facilities across the country, it stands to reason that people will begin to access these healthcare facilities and their health-seeking behaviors would improve. And ultimately, it will translate into the quality of lives that they lead. 57% of births used to occur in health facilities in 2008. Currently, 73% of births occur in health facilities. And then births that are attended to by a skilled provider. Because of the, we will come to speak about the number of healthcare professionals that we are producing. And that is reflecting in these statistics that I'm giving. In 2008, 59% of all births were attended to by a skilled provider. That is a trained midwife or a trained traditional health birth attendant, TBA. Currently, 75% of all births that take place in Ghana are attended to by skilled providers. And that is, it is not surprising that we are winning the battle against child mortality, infant mortality, and under mortality.
Simply that today, would-be mothers or pregnant women
yes,
are getting access
better
to
health
a
care,
lot more care from skilled people who are helping them deliver.
Because of the training of more health personnel. And let me elaborate on that. For instance, in 2005, or better still in 2008, just about 30 health training institutions existed in the whole of Ghana. By 2015, that had jumped. It has tripled to 95.
From 30
to 95. Again, let me put it in perspective for you. A few months ago, when Dr. Bamia once again attempted to shed light on the NPP's achievements, he said that as part of their achievements in health, they built 6-unit classroom blocks for nursing training colleges, a library, a dormitory, or what have you. Now, we have many of those. So we don't even put that in our book. We did not just provide 6-unit classroom blocks. We actually have ensured the addition of 60 health training institutions, whole institutions, not just classroom blocks or libraries. And sometimes it is laughable when the FVP comes to speak about the achievements, in spite of all their lofty rhetoric and sometimes the unhealthy noises that are made. We have concrete achievements, and these are measurable and captured in the book Accounting to the People. Now, let me come to midwives. How many midwives we train? Do you know that in 2009, only 500 midwives were trained in Ghana? Or what I mean was that the number of midwives in Ghana, licensed midwives, was 500. Currently, it stands at 2,000. So it should not come to you as a surprise if more people or more pregnant women are receiving health care from skilled personnel. That is what accounts for this. And we are training more and more people in auxiliary healthcare delivery services. UHAS, for instance, currently they've started a course in medicine. Hitherto, it wasn't the case. They admitted their first batch of medical students last year, and because of the expansion, the modern campus we provided them, which we mentioned, and the education, they are able to take more. Currently, they have a student population of 2,100. They started with just 55 students. So it tells you the progress that has been made. And then the University of Ghana Teaching Hospital also. Now, the University of Ghana, instead of going to train their students at Kolebu, can do so on their own campus because of the existence of this ultra-modern quaternary facility. So there's a clear and visible improvement in training of medical personnel. So we are fulfilling that aspect of quality healthcare which you mentioned at the beginning of this
whilst we are on mother and child issues, it's also significant to put out that I mean, we've increased the number of midwifery training schools
Absolutely.
from 14
Absolutely.
in 2009 to 31.
Absolutely. That is
from 14 in 2000.
That is more than a doubling. That's 17 more have been opened within a space of 8 years.
Well, if you just joined us, this is the Majority Caucus. My name is James. I'm here with Honorable Deputy Minister for Communications, Felix Kwakye Ofosu. We'll be happy to hear from you on facebook.com/joynewsontv. facebook.com/joynewsontv. If you like to send us a WhatsApp, the number is 056 0800 000. 056 0800 000. We'll be happy to share your messages with the rest of our viewers. Now, let's come to the area of national health insurance. You know that in government's effort to widen access to decentralized healthcare delivery, the National Health Insurance Authority plays a very significant role. But lately, you don't seem to hear beautiful stories being told about it from people on the other side of a political divide. When you listen to them, the sense you get is that it is dead, it's gone, it's non-functional. Is that what it is?
Well, generally, the MPP's narrative on any national issue is obfuscative and misleading. What they do is to peddle blatant untruths about government work and government's achievements in a bid to undermine the confidence that the public has in government. So one should not be surprised if you hear these claims from the MPP. It is something that cuts across multiple sectors. But zoning in on the health insurance scheme, you see, you measure the success of a scheme like that by specific benchmarks, which are used universally. So you use benchmarks like outpatient utilization. In other words, how many times do people access healthcare using the NHIS card? Or how many times, simply put, do people go to the hospital to access healthcare using an NHIS card? And then you look at claims payment. How much money is being paid to the service providers who render these services? Let's come to outpatient utilization. First of all, the health insurance itself is an idea that predates the MPP. All the parties that contested the 2000 election had in their manifesto a health insurance scheme. The first pilot of health insurance was done by a Catholic priest at Nkranza. Because of that, he was actually given a national award by President Rawlings. Government then sought to replicate that pilot at places like Dangbe East in the Greater Accra region, Afram Place and other places. In fact, if you go to the 1997 State of the Nation address of President Rawlings, he stated that government had begun the pilot of the National Health Insurance Scheme. Instructively, Dr. Adokufo, who was then the minority spokesperson on health in 1999, engaged the then Deputy Minister for Health in the year 2000, that's Mr. Moses Daniba, on the health insurance. When government was piloting a national health insurance scheme, Dr. Adokufo stood up in Parliament and said that the MPP was opposed to that scheme and that it was a waste of resources and that it would never work. So that puts into perspective whose idea health insurance was. But of course, the MPP implemented it because they were in power after the piloting phase. So in 2005, the health insurance scheme came into operation. Outpatient utilization, which I have indicated, measures the number of times people go to the hospital to access health care with the card, was, less than 600,000. That is 570,000. People went to the hospital 570,000 times to access health care. In 2014, the same outpatient utilization was 29,637,189. In fact, in 2015, it exceeded 30 million. So how is it possible for somebody to claim that a scheme that has seen outpatient utilization jump from 597,000 to 29.6 million has collapsed? If you come to claims payment...
Maybe before you come to claims, let's get viewers a little involved so they don't feel left out. This is from Tony in Italy, Milan, and he says, my great regards to the Honorable. I love him. Tell him he's the only NDC who speaks with ease and confidence, and that's from all the way in Italy, Milan. NDC has achieved a lot, so let us vote for NDC for 2016, JM all the way. That's sent by Adams from Sefi Esam. And this says, this is clear indication that Dr. JDM will surely win November 7 polls. I choose JM. I choose Ras Mubarak by Issa Baka from Kumbungu constituency. I'm just doing a small analysis here. Mr. Ofosu Kwakye is saying 217 to build 617-bed hospital. Well, it's a bit confusing. That's from Eskin in Aguna Suedro. Eskin, if you could make your text slightly clearer, we would be happy to share that with our viewers. And this says, excellent work by John Mahama. Please go out there and campaign very well, because people now judge government with light bills and the price of fuel. We can't go into position with these achievements. Nana sent that from Cape Coast. And Eric J. in Sunyani says, I salute Honorable Felix and my own comrade James, and I'm enjoying the program, which I classify to be evidence-based. Indeed, JM is working for you. Please, why under health sector projects in my constituency? Okay, he's asking why health sector projects in his constituency is not captured. This is from Eric J.
Well,
in Sunyani.
I'm sure that perhaps it was a matter of space, but these projects that have been undertaken at the various districts are available for all to see, and we will endeavor as much as possible to
And in fact, the
them.
Green Book is not exhaustive.
It's not exhaustive. It cannot be exhaustive. But if we were to exhaust everything, perhaps we would need a 1,000-page book.
Okay, Biggie from Tatali says, kudos to you two most vocal and intellectuals in our party, NDZ, and country at large. When it comes to healthcare provision, JDM has no size in Ghana, changing lives, transforming Ghana. Felix, now let me come back to you. I think you were making a point before I decided to rope in these messages.
Yes, I'm making the point about the benchmarks that are used to assess the health of any health insurance scheme anywhere in the world. Claims payment also shows you how much money is being paid to health service providers. In 2005, once again, when the health insurance started, total claims payment amounted to 7.6 million Ghana cedis. In 2014, total claims payment amounted to 1,073 million Ghana cedis. That is an increase of 14,000%. So I'm unable to reconcile how a growth of 14,000% in claims payments can be used to explain a collapse. Perhaps the MPP should be educating us what kind of collapse that is. If this is collapse, then perhaps the health insurance scheme should collapse every day. Of course, we are not unmindful of the fact that challenges exist in the health insurance scheme. There's a financing gap that everybody knows. It is a subject of scrutiny by a panel set up by government to look into ways of injecting greater efficiency into the health insurance scheme. And they are looking at a number of models and options to advise government on. And this will help us ensure that the health insurance scheme is even more robust. But there's no health insurance scheme anywhere in the world that hasn't had problems. The health insurance scheme in the UK has been existing for about 60 years, and yet it continues to face problems every day. On a daily basis, we hear about complaints from our subscribers and what have you. But any claim that the health insurance scheme has collapsed is completely false in the face of these glaring statistics that I've given you.
All right, now let's look at, is there any kind of support being given vulnerable groups, people who require some kind of assistance, say people in leprosy area? Is there any kind of support being given?
Absolutely. The NHIS, in conjunction with the Ministry of Gender and Social Protection and other stakeholders, has been rolling out a number of social interventions in consonance with our social democratic principles. Because of that, over 10,000 such people in the leprosy area, people who are in the aged bracket, people who are unable to pay, have been enrolled for free. And it is an ongoing exercise. They do it many times. Indeed, between 2009 to date, about 1 million of such people have been enrolled on the NHIS and are benefiting from the scheme. You also are aware that people below 18 years are enrolled for free, and they don't pay any premiums at all. Pregnant women, leave beneficiaries, indigents, people in special homes and what have you, all benefit from this package that government has put together for them?
Well, we're inching closer and closer to the end of the show, but we cannot talk about hospital infrastructure, equipment, without talking about personnel, training. What is being done?
Yeah, I made mention of the establishment and expansion of the existing health, facilities. The University of Health and Allied Sciences, I beg your pardon, is a typical example. That institution is going to help train medical personnel, both in terms of doctors, nurses, and auxiliary health professionals, laboratory technicians, and other such categories. There's a school of pharmacy coming up at Kita, and that would also show up the number of pharmacists that we have in the country to augment what happens at KNUST. If you come to the University of Ghana, like I said before, in the past they had to go to Kolebu for their clinicals and other lessons. Now, because of the quaternary ultra-modern University of Ghana health facility that is being put up, they will receive such tuition right on their campus. So it saves the time and energy and resources that will be used to transport them to Kolebu and that place. We've spoken about the number of health training institutions, which has increased from 25 in 2005 and 30 in 2008 to 95. It is a tripling of the number that existed. We've spoken about the number of midwives trained, which has moved from 500 in 2008 to 2,000 by the close of last year. The personnel for the National Ambulance Service, 547 of them have been trained in the period under review and are in a position to dispense emergency health care to people who are in need of such. So there's a whole comprehensive program aimed at boosting the capacity and increasing the numbers of health personnel to complement efforts that have gone into expanding infrastructure in the health sector and providing equipment.
All right. Now, I just want you to tell us a bit about these Onuado vehicles, which is more like health facilities on wheels. What's behind that concept?
Well, basically, in spite of the effort to decentralize healthcare and the establishment of CHIP compounds and health centers and other small clinics and hospitals, there are some remote parts of our country that are not easily accessible, where healthcare is not readily accessible to people. So as a way of bridging that gap, pending the full rollout of the CHIPS compounds initiative, the Onuado concept was launched by President Mahama. There are 8 highly equipped mobile vans that are able to dispense health services in dentistry and minor surgeries and eye services and what have you to people in need of it. And they are able to go to the remotest parts of our country to render these services. So in a nutshell, the Onuado service is simply healthcare at your doorstep. And such medical needs, as I've described, are able to be dispensed. So it's one of the ways that government is bringing healthcare to our people in a comprehensive fashion.
Well, oftentimes also it appears that question is asked about social protection or interventions that are being given, particularly in the area of health. Also, I'm aware that the Gender Ministry, for example, is providing urban cards.
Sure.
Band cards.
Sure.
What does that mean?
The urban card is a card that enables our senior citizens to access various services across various sectors. For instance, if you had an urban card, and because of the arrangements that government has with some financial institutions, if you went to a bank, for instance, you'll be given priority service. The urban card allows you to have a 50% rebate on transportation fares on metro mass buses and other state buses. So 25,000 people in all are being rolled onto this. As I speak, as of last year, 10,000 beneficiaries had received the card. The remaining 15,000 will receive it. Let me speak briefly about LEAP. Often,
30 seconds.
The MPP claims that intervention has collapsed. In 2008, only 1,654 households benefited from LEAP, and that is after 8 years. In the last 7 years, a total of 116,000 families have been put on LEAP, and that is an increase of over 6,000%.
I'm afraid that's all time will allow us. Maybe we can rope in this one from Ben Kasapin. Says, hi Felix, you're doing a good job for the NDC. Keep it up. More text messages and WhatsApp messages that we're unable to bring to you, but that wraps it up here on Majority Caucus. We'll see you again same time next week. Good evening.